Welcome to Level Up Conversations presented by TEDxYYC in partnership with First Calgary Financial. Today's episode will focus on mental well-being during COVID. We welcome Dr. Megan McElheran, clinical psychologist and CEO of WGM Psychology. Her work over the past 16 years has focused on trauma-related conditions and post-traumatic stress disorders. We will be discussing the impact that COVID-19 has had on mental health. Hello and welcome to the Level Up Conversations here today. My name is Tim Tamashiro, your host, and very glad to be here because, COVID is something that has been affecting us all literally in so many different ways. And we're going to learn a little bit more about how COVID has been affecting people and what it is that we might be able to do to help become healthier in our own headspace around the challenges that we're faced. I'm being joined today by Dr. Megan McElheran, and there's Megan there on the screen. Thank you so much for joining us, Megan.
Thank you very much for having me. I really appreciate the invitation. It's lovely to be here.
You and I were kibitzing just before the show, and I was saying, boy, you have a really unique scenario. Not only are you dealing with professionally at work all these COVID challenges, but you're a human being. You get to deal with it as well.
This is true, and sometimes I even forget that, there's a human element to what I go through too. So there's been a very interesting process this last number of months of, trying to help the people that I work with in my practice and help my colleagues as they negotiate their practices and their clients, as well as realize that I'm going through this too, and I'm not immune to the challenges and the stressors that this has brought about for all of us.
Yeah, it is. It is so challenging for everybody. So how are you finding it personally? I'm curious about you as a person first.
I'm going to say some things that maybe seem contradictory. So on the one hand, I could have done without this last number of months because it's been extremely stressful, as everybody is experiencing, just in terms of kids coming home and working from home, and are we safe to go out, and can we see our families? And then simultaneously, there's actually been this odd benefit that I found from this time, because it has forced me, as it's forced many, to really slow down. We haven't had the pressures or the commitments, or, I do a lot of traveling and speaking in other places, and all of that obviously was canceled when COVID hit. So it's actually given me a very interesting opportunity to really pause and reflect on how have I been living my life, and how do I want to live my life moving forward, and really kind of encouraging a different sense of intentionality about how I want to approach both my work and my personal life.
Yeah, and thank you so much for bringing that up, because I've had a similar experience in that I've noticed that because COVID has limited the amount of opportunities that are out there, then I'm digging more into personal interests. I'm studying music maybe a little bit more. I've picked up my ukulele a lot more often than I have in the past, and I feel that it helps kind of clear out all the junk that is happening in my mind, and I don't worry about money as much, and I don't worry about career things as much, because there's only so much you can do about it, right?
Yeah, that's right. And I think a lot of us have been feeling that way. I know it's this contradictory thing where we don't want to minimize or dismiss how stressful and challenging this has been, particularly for people who have suffered, economic losses, or who themselves have been diagnosed with COVID, and so on. And at the same time, I have heard lots of things from lots of people about appreciating the opportunity to be together differently with family. And again, just like realizing that, and I'll speak personally, like probably 75% of my life most of the time is noise, and when sort of, forced or having this imposed on me to kind of turn the noise down, lo and behold, the sky didn't fall. And actually there's been some really important benefits that have come from it.
Yeah, it's interesting how we are able to adapt to all that noise prior to COVID. Yeah, I was watching a movie the other day, and I know that the movie was just released, like literally this last week, but it was filmed just before COVID, and it was people just kind of living their normal lives, and it felt a little alien for me to watch that. Isn't that
Yeah.
strange?
I actually love that about us as a human species, right? I find that fascinating about us because who would have thought 6 months ago that we would be sitting here having this conversation, talking about, the benefits we appreciated out of this worldwide pandemic and fiscal and economic shutdown, right? Like we would think that that would just be disaster. And yet we are so adaptable. That's one of the things that I think is just so intriguing about us as a species is that we find this incredible way to adapt and evolve and frankly make meaning out of the adversities that we face.
Yeah. So with all the changes that have happened, many people have had profound changes. Do you think we're at a time now where these changes are starting to become the new normal and people are starting to get healthier because they're able to deal with it in a fresh way?
Yeah, it's a great question. And I think it's a little early to tell, Tim. I mean, I think one of the things that we know is that this has been a time of, if we kind of look at the difficult ends of what COVID has done, this has been a time where, change has been forced and thrust on people,
Yeah.
whether we're talking about change, in their jobs or in our communities, but also just change, we're talking about racial bias and discrimination differently in our society and in our
Oh, wow.
cultures. And change is not easy for people, right? Even if it's good change that people welcome, change is inherently stressful because it's a move away from what is familiar. And we do have this tendency to want to hold on to the things that are comfortable and familiar to us. My hope is that there are experiences we've all had collectively through this that are going to sort of form a new part of our kind of collective unconscious, and we're going to be informed as we move forward in a different kind of a way. And I hope we're not in some ways going to go back to the old normal, and that there is a new normal that we'll move into. And I do think that we're going to have to establish a new way of being with one another that is informed by this incredible experience we've just gone through.
Yeah, but yet we're seeing all these challenges that are happening, especially with our southern neighbor, where we see that there's those lines are just so blurred
Yeah.
between what is going to help create greater health for everybody and what is going to create greater health for me personally. And there's a lot of I don't know if it's fair to call it nostalgia of people
Yeah.
just wanting to get back to their normal life and refusing to help others. Is that creating additional stress then in COVID?
I think so. I think what we're seeing, I mean, the degree of anger we're seeing from people, in Canada and US and other parts of the world, the kind of anger that we're seeing to me belies the degree of fear that people are going through, and frankly, a sense of loss. And when
Yeah.
people experience fear and loss, they want to look for someone to blame. They want to have a reason why they are feeling uncomfortable and why things are difficult for them. And we're losing sight of the fact that what is good for me personally is good for the community, and what is good for the community is also good for me personally. We're losing sight of that, I think, a little bit in COVID. And I think that's part of the conversation we need to keep going, is that, we really are in this together, and that needs to be more than just a bumper sticker, right? That we
Sure.
help ourselves by helping others.
Sure. That's a hard thing for people to do, right?
Yeah.
To
Yeah.
think in terms of. I brought up this issue or brought up this point many times in these discussions about COVID. So when I traveled to Japan a couple of years ago, I noticed that there was a great deal of people walking around with face masks. And
Huh?
when I asked about it, one of our hotel concierge said, "Well, people walk around with face masks because they feel they may have a cold or some sort of an illness, and they don't want to share it. They don't want to spread it."
Huh?
So it was really based on an honor type of a scenario, as opposed to what we see in North American society, where if people see a sign on a restaurant that says "No shirt, no shoes, no service," they're okay with that. But somehow,
Yeah.
if they say "No mask," then it's an affront to their personal freedoms.
Yeah, and I think what's happening, Tim, I mean, some of this is my own hypotheses, but it's informed by some of what I've been reading about COVID. I think what we have is a lot of people who are in a deprivation mindset. So they're looking at what's being taken from them or what's been done to them. And I think the challenge and what we need to be focusing on is how do we help people shift into more of a growth mindset and a challenge-oriented mindset, right? That, if this cannot just be about, I'm afraid of what else is going to be done to me, but I'm actually more considering how I can be part of the solution, right? Like that is a qualitative shift that actually really
Sure is.
influences how people relate to themselves and how they relate to other members of their community, and relate to this notion of wearing a mask can be helpful for your neighbor
And to your family,
and your
and
family.
to your
Yeah.
friends, and those types of things. What type of a shift happens when a person goes from a deprivation mindset to a growth mindset? Are there steps to start considering, or
Yeah,
I
I
mean,
mean,
it's hard to encourage it. It's because it's, again, it's just, it's other people. You can't
well, and
make
it
them do anything.
no, you can't make people do anything, right? What you can do is you can shine a light on the ways that people are coping with this, and they are relating to themselves and to other people, and you can help them look at their own history to evaluate, is that actually helping them to feel more settled and confident and competent in their lives? And the answer most of the time when people are in a fear-based way of looking at things or a deficit mindset is no, right? They're just scared, and they're anxious all the time, and they're somewhat paranoid, and their information processing is compromised, right? The idea of moving into a growth mindset actually doesn't have to be as daunting as it sounds. Like, these are big words, that we're kind of throwing around. Just sometimes even tagging on to the end of a statement that you make to yourself, like, I'm not wearing a mask, even saying I'm not wearing a mask yet, right, leaves it open for the possibility that, maybe there's a flexibility that somebody can employ down the road, right? So, we're not masters of this pandemic and COVID yet, right? We're figuring it out every day. I mean, I certainly am learning new lessons. You may be as well.
Oh yeah.
And so, right, we're staying in this fluidity and this flexibility of continuing to allow ourselves to learn. And that's what I think the individual person sitting at home today can kind of think about is, maybe I'm not ready today, but maybe I'll be ready tomorrow. And even just starting to allow ourselves to, evaluate our experience in that way can actually help us into shifting out of some of the patterns that aren't working for us.
Yeah, that's interesting. I was snooping around. I wanted to get some. Here, I got one in my back pocket here. I just got to get it out here. I was looking around for a mask
Okay.
masks that I could wear that could serve a couple of purposes. Number one, to be able to protect myself and to protect others, but I wanted to convey that meaning. So the mask that I found, this one just says "Take care,"
Oh, nice.
and if you see, I don't know, maybe there's a way that we can kind of project that meaning while we're wearing masks around the community, just in honoring other people.
Yeah. Well,
Maybe
there's a
that
young
can make
woman that
some sort of a change.
there's a young woman I worked with a few years ago who was writing her thesis on the importance of memorial tattooing after someone suffered a loss. And so, oftentimes you'll see people get a tattoo in honor of their lost child or parent or spouse. I wonder if there's something about, if masks are going to be part of our reality, probably for a while yet, and who knows what's yet to come down the road.
That's
I
right.
wonder if that's part of what we might see, is that, instead of this clinical, hospital mask, that actually you start to see it become more of a person's idiosyncratic message or personality that they want to convey to the community. It doesn't have to be just about silence. In fact, it can be something about self-expression.
Self-expression. That's yeah. It could be like a fashion statement or something along those lines.
Yeah. Yeah,
Perhaps, I don't
totally.
know.
Yeah, I think we'll see that.
Do you find that people are brushing some of their challenges under the rug, suppressing their COVID challenges, and maybe doing more harm to themselves than good at this point in time?
Yeah, I think people do that, generally speaking, Tim. Like, I think that, we are not actually all that we're not all that well indoctrinated or trained about how to deal with our painful and difficult experiences.
That's
Unfortunately,
right.
we live in a world that, or in our society at least, that really equates happiness with success, and so, it's oftentimes difficult for people to consider or contemplate things happening inside of them that aren't about happiness and success, because they interpret it as being signs of failure or weakness. And so, yeah, I think it's hard for people to take a pause and really look inward and realize that, there is pain that they're experiencing about the changes going on in the world, and about the pressures they've been facing, and how overnight our world changed. Absolutely. There's a tendency for some people to be pulling away from that. And, that's problematic. Like, we're going to anticipate in the mental health field that there's going to be a real surge of people who before COVID were not experiencing like diagnosable, clinically significant mental health problems, who post-COVID will be, right? And there's a dance, there's a dynamic that goes on in each of us when we divorce ourselves or cut ourselves off from our emotional pain and the things that are happening inside of us. That leads to, longer term disruption. So, I have a real focus on that just in my practice and a philosophy around treatment, period, which is, emotions and pain. These are not dirty things and dirty words. In fact,
No.
they are part of what makes us who we are, and part of, frankly, how we grow and how we turn into the people we're supposed to be.
Yeah. Uh, what is it that we can do? I mean, do you have some strategies on how we can deal with anxiety and stress and maybe even signs of depression during COVID?
Yeah, certainly, because those would be you just hit on the three that we would anticipate that people would be reporting most, that they're feeling anxious, they're experiencing more stress, whether they actually are or not, their subjective experiences of more stress, and certainly more symptoms or signs of depression. So, the number one thing that anyone can do for themselves is to really try to adopt a very compassionate, and, sort of self-compassionate, normalizing point of view, right? It is perfectly natural and understandable that people are feeling uncertain, confused, scared, and angry, right? There's nothing wrong with those experiences and those feelings. But part of it also is recognizing that, that is coming from these environmental conditions that we are currently in. And what we can do to help ourselves is really, take a longer term kind of perspective on this. This is not going to be here forever. Our experience, changes and passes from day to day. We've even seen that over the last 4 or 5 months. And when we focus on what we can control, and when we focus on, our mindset and how we take care of ourselves, that actually helps us to reduce our sense of anxiety, because the internal part of us that's going, oh my God, what's wrong? What's happening? We're quieting. We're kind of, conveying a message of, we've got this. We can take this a step at a time.
It's fascinating. And yet, I mean, one of the questions that I have on a personal basis, I am scared to death of getting COVID.
Yeah.
Like it really plays tricks on my mind. It's the one disease that, and I say, learn more about what the disease is in its actual form once you get it in early cases, and then what you go through in order to heal. We're learning now that there's a lot of future physical and even perhaps mental problems that can come along with having COVID as well, including psychosis. So I don't know if that is even a viable or fair assumption to put out there, but from what I've read through medical studies, that's the case. So what is it that people like I can do in order to be able to just kind of get more comfortable with living in the world of COVID?
Well, to some extent, Tim, even just to what you said, like, I think it's important that we all strive to have reasonable expectations, right? I'm scared of getting COVID too. I've had a couple of patients who have had COVID, and it's interesting. I just learned yesterday that recovered from COVID means you didn't die. It doesn't mean that you're completely symptom free. Yeah. So, I think there's lots of people out there who are not contagious and have, so-called recovered from COVID, but they're still dealing with systemic impact of having had the virus. So I'm with you. I'm scared of that too, right? I also know that if I live in a place where I am thinking all the time that if I go here, or if I talk to this person, or if I do this thing, I'm going to get COVID and it's going to be the worst thing that ever happens to me, I'm never going to leave my house. And that's actually going to make it worse and worse and worse and worse and worse for me, right? Because I'm going to cut myself off from my social supports. My work will probably suffer. My sense of purpose and contribution is going to be impacted. So, I think we have to try to find the space in the middle. We can't sort of go, well, fatalistically, we're all going to get it, so who cares, and let's not take any precautions, nor can we lock ourselves at home. We have to be very deliberate, and we have to be intentional. And again, we have to be really compassionate and understanding. Sometimes when I go out, I am scared that I don't know who's around me. Sometimes I have people come into my office and it crosses my mind, like, well, what if they have it? And where I have to go to is, well, I'm taking all the precautions I reasonably can. I also know about myself that, when it comes to these kinds of serious adversities, I will deal with this should I contract COVID. And I don't know if I'm going to contract the type that is going to end up in, major impairment or even, fatality for me. But I have to keep living my life, right?
Yeah.
And I
Do
think
you,
it's interesting. One of the things we know, sorry, I didn't mean to interrupt you, but one of
go
the
ahead.
things we know is that people who are living in countries who have experienced kind of continual strife, right, where there's been ongoing civil war or
Hmm.
famine, or they're actually, from a mental health perspective, they're doing a little bit better with COVID, because they kind of constantly have to live in this reality of, I face perilous things every day, and I still have to get an education and work and feed my family and so on and so forth.
That just blew my mind.
Great.
Well,
Yeah.
isn't that something? So that
Isn't that
so
something?
they do you believe then that maybe those people in those war-torn countries or that are dealing with even more significant threats to their lives are able to kind of put it into perspective and say, well, my chances of getting COVID are a lot less than me going out and having some sort of a conflict that is going to harm me physically.
Yeah,
Is it?
or, their perspective is just, this is kind of one more thing that I cope with. And so, when I'm talking about my basic needs of needing to put food on my table and keep my family safe, that's where my focus is, right? We don't, we're very fortunate that we don't have those kinds of daily, threats to our survival.
Yeah.
But I think we can learn something from that, right? Which is, we are incredibly resilient as a human species. We are going to survive this, right? And we are, what
Sure.
I love to think about, is that right now, as we go through this, the ways in which we are growing as individuals and as a community as a whole and as a world as a whole, like I just can't wait to keep hearing about and learning about all of the things that are going to be the other side of COVID, right?
Yeah.
And I think we have to hold on to that, right? That yes, we are in the face of something that could be very damaging, to us physically, and certainly all of the mental health effects we're talking about. And that is not a fait accompli. There's lots of ways we can empower ourselves and take care of ourselves in our communities.
Yeah, on some moments I'm going, oh, I can't believe all the creativity and innovation that is coming out of COVID, on so many different levels, through innovation in the arts and through business innovation and through ways for people to be able to just kind of deal and cope, and for masks to be able to come out so that they're going to be interesting and helpful for people. I mean, I think that's the savior for me personally, is that I consider this a real renaissance of
Mm-hmm.
ideas.
I love that word renaissance, and I completely agree with you, right? Like, this will be a transformational time in our world. We're not going to, I really don't think we're going to revert back to pre-COVID, because how could we, right? We're going to be so fundamentally influenced and changed by this experience that we will grow into and shift into, kind of the next phase of what our lives are going to look like,
Yeah.
and frankly, I think about, for people like me and perhaps you and others. I feel very, very privileged and very fortunate that, I have the means to take care of myself. And my business, oddly, well, not oddly enough, I suppose, but, we're busier than ever. And that's not the case for lots of other people out there. So,
Yeah.
I feel like a call to order about, like, we who have been able to withstand the impact of COVID need to be here for the other members of our community, because as I think about people listening to us talk today, we also have to appreciate that there are a lot of people out there who are really, really struggling,
That's right.
and
Yeah.
they need, the people who are really struggling need to understand that there are reasons to be hopeful. One of the things that I'm really fond of saying these days is, like, we have to work to change our worries into hope, right? Because it doesn't cost us anything, and it actually helps us to be, healthier. It helps us to be more in that growth mindset.
Any helpful tips on how to change worries into hope?
Well, you know what? Let me just give you an example using our talk today, right? Like, I mean, I could come into our talk today, and frankly, I did a little bit, going like, oh my goodness, like, is it going to go
Yeah.
okay? Like, what if I have nothing to say? Da da da. And shifting that, shifting that into hope is, like, I really enjoy talking to new people, and, like, I have some things to offer, and I hope that people find it useful, right? Like, they're small shifts, but they're powerful, right? Me thinking, I hope it's well received, is different than they're going to hate it, right? And when I'm in there
Yes.
going to hate it, all I feel is, scared and worried and all these things. When it's, I hope they're going to like what I have to say, I feel somewhat depersonalized from the outcome, and then I can just enjoy myself, right? And I think we can practice that. Like, there's all sorts of, worries, like, what if I don't have enough money to pay my rent at the end of the month? and can be shifted into, I'm resourceful, there's people I can call, and I have to, I'm going to extend some trust that there will be help to be found.
Yeah. Uh, there are so many people now that are going back to work, back into their offices. There's also lots of people that are doing work still from home and having to kind of deal with things that way. Do you have any direction that you might be able to give to employers about how they might be able to assist their employees deal with COVID, and to allow their employees to perhaps even have a little bit more input on where it is that they're going to work?
Yeah. So, I think pretty generally speaking across the board, we saw employers really kind of step up and do what they needed to do to help their employees transition and kind of manage the last few months. I think it's really important for employers and individual employees to realize that this time of transition is arguably actually more stressful than when we all went home. Because
Sure.
when we all went home, it was like, okay, well, this is what we have to do, and we're not sure what's going to move forward from there, and we'll just figure out a way to adapt. Now, we're not doing it in the same way at the same time in the same industries. And so, compassionate leadership is called on now more than ever, right? So, recognizing that not every individual employee is going to be feeling the same about this at the same time, right? And first and foremost, or primarily, employers need to have there be a kind of a regular ability for people to touch down and talk about how they're doing in this period of transition, right? The notion that it's kind of like we're coming back to work. Yeah, you've got your mask on, and it's kind of let's get back to work and business as usual. Like, we really need to challenge that way of doing things, because people are still scared. People are still trying to adapt, right? So, even 5-minute opportunities for people to check in with one another, and creating that as a sort of a normal workplace kind of health and wellness approach, that can be actually really profoundly helpful, because it's just an acknowledgement from the employer of, we know this may still be hard for you, and we're here to listen, and hopefully we have some resources that we can direct you towards, right? I'm not sure if employers have that or not. Some will and
Yeah.
some won't, right?
Yeah. Do can employers reach out to professionals such as yourself in order to be able to get those resources?
Absolutely, yeah. I mean, and,
Yeah.
and one of the things that we've really seen in the last number of months is we actually have a lot more funding has gone into public programs. So, we saw the federal government gave some significant funds towards the development of mental health resources. So, absolutely, my encouragement to employers would be, have a pathway to care identified, right? Like, who's your EAP provider? What are community-based resources? How do people access help if they need it for themselves or their family members? Do an in-service on, here's your health and benefit plan, and here's how you access it. Like, these are small things, but they actually, especially if people are feeling stressed and uncertain, they can actually be really helpful. Because one of the
Yeah.
things that's hardest when people are feeling really anxious and uncertain about something is trying to gather information and make sure they've got the right answers for themselves.
Yeah, so those employee assistance programs that you're speaking about, so many of those things, I know with the ones that I've had in the past, they're cumbersome to negotiate,
Yes,
to
yes.
wrap your head around, right?
Yeah.
So I love your suggestion to be able to have employers perhaps just kind of lay out what the program can do in terms of mental well-being, and to help their employees be able to utilize those services on a regular basis without having to use it up. And the thing about EAPs is that,
Yeah.
you can't just kind of go, well, I have so much that is good for mental health, and I have so much that's good for a massage and everything else. They're hard to negotiate.
Well, totally. And like, are there fee splits? How, like, do we need a referral from a doctor? Like, just answering some of those questions can just be really helpful for people, because then they don't, they get the sense, and reasonably so, that their employer cares about them, and then they actually know what to do and where to go. The other thing that I would encourage employers to reflect on is that, it's been recent that people are starting to go back to work, and probably we're going to see that, over the next couple of months. We're not sure about a second wave, of course. It's really important that employers think about, again, a sort of longer term approach to this. So it's going to be really important at 3-month and 6-month and 9-month and 12-month intervals to actually check in on people and ask some questions like, how are you doing? Because we
Yeah.
know that there's the anxiety and the stress people can go through at the sort of moment, or the as they're going through the critical incident or the acute period of stress. But actually, we're going to anticipate some of those mental health health markers may start to deteriorate once this actually passes. So, we're going to celebrate what, the return or the evolution into our new normal, but we also have to keep an eye on the fact that like there's a surveillance of people's mental health that's going to be important probably for a year, 2 years, even 3 years down the road.
Would it be wise to increase the frequency of those check-ins, like maybe perhaps even monthly?
I would absolutely, right? Like,
Yeah.
in these kinds of circumstances, more communication is always best, right? We
Yeah.
don't want to leave people making assumptions or coming, telling themselves their own stories about what's going on. We want to normalize it and make it part of the fabric of our culture and our communities of saying, look, we've all been through this. We're all going to be affected by this differently, depending on how we were, when COVID hit, and what's happened for us in the course of COVID happening. So, just normalizing and having those conversations, yeah, maybe monthly is, if that's, possible, that's not going to hurt, right? At minimum, I'd rather people get annoyed by being asked about their mental health than struggling and feeling like they can't talk about it because there's a stigma or a shame attached to it.
This is the biggest problem that you face, I would imagine, is for people to get to the point where they actually pick up the phone or send an email to somebody in your profession to say, I'm struggling, I could use some help. And, I've been very thankful and lucky to have found with our family, a therapist is able to help us negotiate all sorts of different things. And I lean on her on a very regular basis, just to deal with regular life, just to grow and to learn. And so I don't know if this is true in everybody's case, but in my case, I know that if I feel like I need to learn something, then that's when I make the call. It's not when I say that I am hurting or I feel like I'm losing my mind. It's just I need to learn something about this because it's bothering me.
Yeah, absolutely. Man, Tim, I wish and hope that everybody out there could get to that place because, I think we've seen a transformation in our society over the last number of years around mental health, and I credit things like Bell Let's Talk and other initiatives with kind of making it okay to talk about mental health.
Sure.
But we have to understand that, as people start to suffer, the story that they're going to be telling themselves is one of not being competent, not being capable, being weak, not being like everybody else who can get over their problems. And that just increases stigma and increases isolation and people retreat, right? So, that's what I'm saying. What we can help each other with is just normalizing. Like this has been essentially how I think about it is like on March 16th or 17th, whatever it is, we all boarded a roller coaster, right? I got in my car, you got in yours, and all of our cars took off from the station, but we were on completely different tracks. And so sometimes I went up when you went down, and we were level maybe for a bit, but it hasn't hit us in the same kind of a way. And so we need to just normalize that and keep talking, because I would way rather people go, I'm starting to notice that I'm not really liking how I'm feeling versus, right, I'm not sure I have any other option but to end my life, right? Which is when a lot of people reach out for help, right?
Wow.
We need to do more to make it okay and acceptable and barrier free for people to just acknowledge the fact that, our physical health suffers at times, and so does our mental health.
Yeah, and it's not like you have to have the answer as an individual in order to pick up the phone and to call for help. You can literally just send a message that's saying, I think I could use some help on something. I'm not really too sure what it is, but I think I need some help.
That's right, and
Yeah.
and make that call. And again, if we're thinking from a community or an employer sort of standpoint, make it so that if people have the need to ask for that help, that there's somewhere where they can ask for that help from, right? And
Easily.
easily, right?
Easily.
Yeah.
Yes.
Yeah.
Yeah.
Yeah, where people aren't being confronted with like reams of paperwork or waiting lists or, fee structures they can't afford, et cetera, right? Like
Yeah.
have it be so that when somebody reaches out, the hand goes up and the help can be found, right?
For sure. The one of the resources that I wanted to point out is the Canadian Mental Health Association. That's the website there that's on the screen, and you can reach out and learn some things there. But you can also communicate with that organization, and they can set you up with resources like you, Megan. Is that correct?
Yeah, absolutely. So
Yeah.
Canadian Mental Health Association is a fantastic resource. We have other resources, in Calgary that can
Yeah.
be accessed. Distress Center would be one that
Distress
comes to
Center. I
mind.
just pulled
Oh,
that
you were
up
just
as
going to put that
well.
up.
Yeah.
There we go.
Yeah.
And then certainly, right, practices like mine. We have mental health resources available within Alberta Health Services. There's other community-based practitioners. That's one of the good news stories these days is that we do have organizations and services and people who are there to help. And now it's making sure that, as we're taking care of people as COVID continues on, and hopefully we eventually have a vaccine and move to the other end of this, that, we continue to add to the resources and we continue these kinds of conversations. Because in my humble opinion, it's not if you're going to have a mental health challenge at some point in your life, it's when, right? And probably most of us have already had several, right? Because, our mental and emotional health is part of what makes us human beings.
Yes, I personally kind of look at it. If I have some sort of a challenge, I kind of look at that as my own mind's way of saying there's a lesson to be learned. So go
Yeah.
learn the lesson.
Yeah.
And because if you don't go learn the lesson, then you have to keep on taking the lesson over and over and over again. That can be really,
That's
really
right.
painful.
Yeah, that's right. And the universe is incredibly cooperative in giving us opportunities to continue to learn lessons that we haven't sort of explored or really come to terms with, right? So, I think that the take home is like, let's try to challenge the notion that we should be afraid of the things we may find inside of ourselves. The things that we find inside of ourselves that's the good stuff. That's the richness that makes us who we are and really makes our world, an interesting and intriguing place. And lots of
Yeah.
times, those lessons and those meanings that we're able to call, they don't come during the easy times, right? They come when we
Yeah.
are challenged. They come when, there's some way in which, our feet are sort of held to the fire.
That's it in a nutshell, Doctor. That our greatest lessons are often presented in our biggest challenges, and that's where you walk away with something going, oh, so I need to do X for the rest of my life and to deal
That's
with
right.
it and make it easier on myself, right?
That's right. That's
Yeah.
right. Yeah. Like if we can all sort of be willing to sort of say when we are struggled or we're challenging, okay, like this is an opportunity for me to learn more about myself, right?
Yeah.
We can all rail
There.
against, and I mean, listen,
Yeah.
I'm the first to sort of complain when something's happening that I don't want to have happen. And
Yeah.
I have to challenge myself similarly of going, okay, well, it's happening. And so how do I want to go through it? And what do I want to learn about myself? And if I can envision myself being on the other side of this, what's going to make me feel proud of myself,
That's a nice way of looking at it, and
Yeah.
that's a great way for us to put an exclamation mark at the end of our chat. You've been a fountain of information and help. I've really appreciated talking to you.
Well, Tim, this has been wonderful. I really have enjoyed this myself too, and just am so appreciative that you had me on and had such insightful and wonderful questions. Thank you.
You betcha. Dr. Megan McElheran is a clinical psychologist and CEO of WGM Psychology. You can reach out to her and her colleagues at their clinic anytime, even if you just have a couple of questions in your mind that you'd like to get some answers for. I'm sure they'll be able to help you. And remember those other resources, which are the Canadian Mental Health Association and also the Distress Center here in Calgary. It's a very, very worthwhile program as well. Dr. Megan, thank you very, very much for being our guest today.
Thank you very much, Tim. All my best.
Okay, thank you.